Hey everyone, my name is Aline Munezero, and today my presentation is about analyzing the strengths and the limitations of assertive communication in health and social care. Assertive communication was chosen as it's frequently used when professionals have to communicate effectively, champion the service user, and collaborate with colleagues. The presentation analyzed both advantage and the disadvantage of this method of communication, reviewed the use of this method in health and social care, and considers the importance of this method in delivering person-centered care and working as part of a multi-agency team. Assertive communication is a communication style in which individuals voice their opinions, concerns, and needs in an objective manner while respecting others. In contrast to passive communication, assertiveness invites consent to be voiced and not ignored. Aggressive communication, on the other hand, can be harmful to working relationships through ignoring others' opinions. Communication skills are both verbal and non-verbal, such as tone of voice, active listening, eye contact, and body language. A benefit of assertive communication is that it helps to reduce misunderstandings and enhance service user safety. Effective communication allows for the transmission of key information, including medication review and discharge planning, as well as multidisciplinary meetings. Additionally, assertiveness helps the professional to voice concerns early when risks are detected to prevent harm from happening in the first place. Other benefit is increased trust. Service users are more likely to participate in their care when they feel respected and heard when asked about treatment. Service user advocacy is also boosted through assertive communication, as professionals can speak up for service user choice in treatment, planning, and decision making. Therefore, assertive communication is a factor in a safer, more effective, and personal-centered healthcare practice. Culture has an impact on communication style, and in some contexts, direct communication can be seen as aggressive. Imbalance in power can also pose further difficulties, as service users or junior members of staff might not feel able to challenge the authority regardless of any concerns they may have. For instance, when engaging in discussions about a terminal illness, bereavement, or safeguarding issues, they may need to be a greater level of sensitivity than a straightforward assertive approach. Passive communication, on the other hand, can avoid conflict at the moment, but may not allow for raising critical issues. For this reason, while assertive communication is generally a better approach, professionals need to tailor their approach to individual circumstances and not assume that they will do so in every situation. For other people with several long-term conditions, communication is crucial as they are likely to be on multiple medications and have complex treatment plans. Improved communication is also linked to better person-centered outcome by facilitating understanding and participation in health care decisions. People with chronic health condition might also have an opportunity to address their fears and concerns openly. Communication style should always be tailored to each service user personal, social, and cultural context. However, as not all communication style will suit all service users. Healthcare professionals, by listening and discussing preferences, values, and priorities actively, can get to know individual preferences better and their associated values and priorities. Another benefit of effective communication is that it facilitates shared decision making, as when service users feel respected and understood, they will be more likely to participate. Respectful communication helps to ensure that dignity, autonomy, and choice are upheld throughout the care process. Therefore, good communication can lead to better service user satisfaction, better health outcome, and directly support learning outcome. 3. Assertive communication helps nurses, doctors, social workers, and other practitioners to communicate information accurately and confidently. For instance, assertive communication can make people feel encouraged to express their concerns or to participate in decisions, not keeping their mouth closed. Passive communication, on the other hand, can hinder interventions due to a lack of timely communication of important information. Respectful communication between groups of professionals is also needed for effective collaboration, including when coordinating person-centered care. Hence, effective communication is vital to the achievement of common objectives and directly contribute to learning outcome. 5. I have had to reflect on my own communication skills and have identified the strength and the area for improvement. The strength I have is that I listen to and communicate with others respectfully, which helps me to develop positive relationships with service users and colleagues. I am aware that I need more confidence in raising issues in professional groups. For example, when I am discussing situations that are challenging or when I am questioning questions. Improving assertiveness would be beneficial in advocating for service user and effectively participating in multidisciplinary discussion. In self-practice is a violation of a service user safety and a healthcare worker's responsibility to challenge such behavior whenever it could affect the service user well-being. Professional development and communication effectiveness in the future will be enhanced by continuous reflection. Communication training can build confidence and enhance the ability to handle challenging conversations. For instance, simulations of team tips can enhance communication during emergency situations and multidisciplinary decision-making processes. Learners' reflective practice is equally significant in the sense that it allows the professionals to recognize the strengths and the weaknesses of the learners as well as their development needs. Other way in which cultural competence training can enhance communication by raising awareness of varying communication style among different patient populations that may be interpreted differently. So the enhancement of communication should be considered a continuous process of training, reflection, feedback, and professional development. In conclusion, assertive communication is one of the most effective communication style used within health and social care because it supports clarity, service user advocacy, and professional accountability. Assertive communication has proved to be important to person-centered care as aiding in active listening, shared decision making, and the formation of care plans which are shaped around individual needs. It will also enhance interprofessional working by improving information sharing and enable professionals to work toward common objectives. In this manner, a combination of confidence, empathy, and a professional judgment is required to be able to communicate successfully. Assertive communication, when employed effectively, can enhance service user care outcomes, foster collaborative healthcare environments, and contribute to better health and social care outcomes in various health and social care settings. Thank you for your kind listening. Bye.